society, our mission never been closer to the reality. Promote safe interactions with water to prevent drowning or other trauma is very important, particularly with the COVID-19. Our Quebec drowning report can demonstrate is very important to open and reopen all those swimming facilities because the patrons or the bathers need a place to do their swimming or bathing activities. And this is why it's more appropriate to do that when we have lifeguard on duty, because our drowning report told us this is a place where we have less than 1% to overall drowning situation in Quebec province, to compare with 40% for the rivers and 30% for lakes and 15% for the backyard pool. So stay with us for the next half an hour, 45 minutes to follow our webinar with our speakers. And I hope so will be fine for you. Stay all this afternoon and have a very nice summer. Have a good webinar with us. Thank you.
Hi, everybody. Thank you for attending the Life Saving Society webinar, and I hope your family, friends, and yourself are doing well. It's a pleasure to be with you today. As mentioned, my name is Eric. We'll start by going over the webinar's content. So today we will be speaking about how does COVID can be transmitted, what are the risks in an aquatic facility. We will go through the checklist when organizing activities as a coach in a COVID-19 context. Also, we'll talk about disinfection, first aid, resuscitation protocols that have been updated, and we'll have time to answer your question along and at the end of this webinar. What we are presenting today is based on research that we've made with information both coming from Canada and internationally. We have been working with la CNESST and l'Association paritaire pour la santé et la sécurité du travail, l'APSAM. Also, we have been collaborating with different ministry and health officers to validate the information we are sharing with you today. So let's start by going over the modes of transmission of COVID-19 in bathing areas. The main transmission is being done from person to person. So this is the main mode of transmission. This is why it's really important to maintain physical distancing while being with others. So the droplets are being expelled through the mouth or nose while talking, coughing, sneezing, and then they can be found on various surfaces. Of course, when you're a coach, you are oftenly standing up on the deck and you have your athletes in the water beneath you. So then it's even more important to maintain a good distance between your athletes and yourself. About water quality. In general, there are no major concern. The good thing about COVID-19 is that it is very vulnerable into treated pool. So treated water is able to kill the virus pretty quickly, so it doesn't survive into pool water. For waterfront, we do not have many issues since there is so much water, it gets diluted into the water. So there's no really risk. So the operator only needs to maintain proper chlorine level and pH level as they were doing before, and they should enforce taking a shower. This shower can be taken at home to avoid the use of the bathrooms. Disinfection equipment and surfaces. There are going to be some measures to be implemented about disinfection. Of course, all frequently touched surfaces will need to be disinfected more frequently. about every 2 to 4 hours. They should be disinfected depending on how many people are going and using those areas. For the lifeguard chairs, the arms of the lifeguard chairs will need to be disinfected between each use to avoid transmission between staff members. And all equipment that is being used during the day uh, as a voice tube and first aid equipment, uh, every personnel should have his own kit during his day shift and only exchange from day to day, not having any passing equipment along during their shift and during the day. So it's important to remember that the virus can survive some period of time on surfaces. Disinfection will likely be able to kill the virus when following the proper instruction as stated on the product labels. It's important to avoid landing objects. Some clubs are asking athletes to bring their own equipment. Others will be reducing the amount of equipment being used during training, at least in the early phases. About PFDs, those being essential to drowning prevention, we strongly recommend that they are being kept available for your patrons. Doing so, there is a disinfection procedure that is in place. You need to immerse the PFD into the water for 15 minutes on each side and have it dry quickly before sharing it to another patron. If you are on a waterfront, then you just need to make your own water solution with a little of bleach in it to proceed to disinfection and allow to dry again. A lot of information that we got came from the Safety Standard Commission. I'm going to present you the Safety Standard Commission work. They have been working hard to help affiliates in reopening their aquatic facilities on a national point of view. This is a national commission. You have the website link on the slide. Once you go onto the website, you'll find 4 tabs: General Standards, Swimming Pool Standards, Waterfront Standards, and COVID-19 tab. This is all under the Safety Management Services. The first 3 already existed before the COVID-19 pandemic. So they present standards that you can follow in your organization. The last one was created recently and present various information that is going to be useful to restart your activities. So before we go a bit further, it's important to note that some of the information we're presenting today are obligations and other are really strategies. So when we're talking about new CPR and first aid protocols, those are really obligations that you need to follow. Strategies are when we are presenting tips and tricks to help you restart your programs. So we'll try to be as clear as possible when we are presenting obligation rather than strategies. So in those information bulletins that we saw on the Life Saving Society of Canada website, there are a lot of content. We are sharing information about how to minimize the risk in case of an intervention. Simon's going to go over this a bit later. Cleaning and disinfecting public spaces, water quality management, PPEs for aquatic personnel. This is a interesting part, and we have a lot of questions on this item. So you have information about it out there. And we also have a guidelines for staff training. Staff training when we are doing ongoing in-service training, recertification, and formation of new staff members. So during training, athletes should wear masks when they are going to the aquatic facility, when they're going out, but they should never wear the mask when they are into the water. So this is important not to wear a mask into the water because it can cause problems while trying to breathe. The mask needs to be adjusted, and the athletes or coaches needs to avoid touching the mask. The mask needs to be worn when it is not possible to maintain the 2-meter physical distancing. So if you are able to keep that distance, then there's no obligation to be wearing the mask. But if you cannot maintain that distance, you should be wearing the mask to avoid transmission. So avoid touching the mask, avoid touching your face and your eyes, and of course, wash your hands before and after putting the mask. We have you have to put in place a checklist when your coach and athletes come to the aquatic facility. Everyone needs to do a self-diagnosis to make sure that they do not have any common symptom of a COVID-19. If they do have such a symptom, then they need to refer to the health officers, consult, contact information number down on the slide, and avoid coming to the aquatic facility until they are clear. So I'm going to turn it to Simon that's going to continue with the presentation and will be seeing us a bit later.
Good afternoon, everyone. We're going to continue with the checklist. So it's important that participants, before arriving, are informed of the necessary preventative measures that your pool and your club are going to have in place, so that nothing that is newly put in place for COVID-19 comes as a surprise to them. Okay. The questions need to be asked by every athlete and coach, the same questions that Eric just went over, and those need to be asked daily. So just because they didn't have the symptom yesterday, it doesn't mean that they won't have it today. So you need to check in every day on those questions. Those athletes, if they do have symptoms, they have to stay home, and they should contact public health authorities for further instructions. Upon arrival at the facility, there needs to be either soap and water or an alcohol-based disinfectant handy for cleaning hands. Hand hygiene needs to be done before events, between activities, before and after a meal, and using the washroom as well. The layout of equipment and the number of pieces of equipment that's available needs to be reviewed. So ideally, any equipment that you use as part of your training should be available at a 1-to-1 ratio, so there's no sharing of equipment. And Eric also mentioned for items that it's possible for the athletes to supply themselves, that is ideal. So avoid the sharing, and if there's multiple pieces of equipment, make sure that they're spread out to ensure the recommended 2 meters of physical distancing. Depending on the available space, you might also have to reduce the number of participants that you would normally have at a training as well, to also encourage the distancing. If there is access to changing rooms, then measures will have to be put in place. So reduced access to lockers, reduced number of people permitted in the changing rooms. We do recommend people arrive changed in their bathing suits so that the access to the locker rooms isn't needed. It's important that the activities allow for the distancing, but not just between the athletes and the coaches as well. We've already talked about the sharing of equipment. Try as much as possible to keep your 1-to-1 ratio. If it does need to be shared, it needs to be disinfected between users. In the area around the pool, surfaces, equipment, materials, same rule as your dry land training. If it's being shared, it needs to be disinfected. So that goes for any piece of equipment. And as Eric mentioned before, frequently touched surfaces need to be cleaned on a regular basis. That's more the responsibility of the facility where you are, but it's definitely not a bad idea to follow up and make sure it's being done. Products to allow for disinfecting of equipment need to be easily accessible. encourage their use when they're needed, so when equipment is shared. Any equipment that is used by the athletes needs to be cleaned at the end of the day, and ideally at the beginning as well, so before and after it is used, even if it's not being shared. The water quality standards have not changed with COVID. The amount of chlorine that's normally required in a pool is good to deactivate the coronavirus. You can check the logbooks. You can ask to check the logbooks at your facility to make sure that the levels are correct. It's important also to make sure personal protective equipment is accessible. So for you as coaches, you'll need access to masks if you're going to be in a close proximity to the athletes, and if you're ever in a situation where you're going to be getting in closer contact, eye protection and gloves, such as first aid situations, if there's any that you have to deal with, and we'll talk about that a little bit more detail as we move on. Before leaving the site, any PPE that was used needs to be disposed of properly. So disposable PPE needs to be removed and put in the appropriate waste receptacle, and anything that is reusable needs to be disinfected and sanitized and ready for its next use. Once the PPE is removed, wash your hands, and we recommend when you arrive at home that you change your clothes and wash the clothing you were wearing at work. A lot of coaches also have to act as lifeguards for their groups. So we will cover now some of the lifeguarding elements of the webinar. So when it comes to scanning a pool, particularly outdoor, polarized sunglasses are recommended, but they aren't necessarily considered safety glasses. So when we talk about eye protection in terms of PPE, then we are actually looking for a visor or safety glasses, not sunglasses. For positioning, it's important that the lifeguards or people who are lifeguarding, just like the coaches, are 2 meters away from everyone else. That being said, you still need to make sure, if you're being responsible for watching the pool, that you're in a position where you can see the entire basin or your zone of the basin in a constant manner, being able to see the bottom. You should wash your hands between rotations, between activities, between groups of swimmers if you're coaching different groups. Common areas, lifeguard chairs, if you have a chair there where you're coaching, all of that needs to be disinfected. Wash your hands after disinfecting a surface, and if you are lifeguarding from a chair, the mask is not necessary when you're on the chair. On the first aid side for life-saving and resuscitation, your first aid kit is going to need some extra items. We suggest that you have them in a bag attached to the first aid kit so they're very easy access. So you'll need some kind of alcohol-based gel for disinfecting your hands. You're going to need a pocket mask that has an antiviral filter, eye protection like a visor or safety glasses, procedural masks. It has to be a medical procedural mask. It can't just be a made-at-home face covering, and gloves. The other thing that we'll talk about as well are surgical jackets, which are optional but also recommended. In terms of training, so when you're going to be training for life-saving and resuscitation, if that's part of your training, then we'll be using rescue mannequins, CPR mannequins, to be able to do those trainings while maintaining the physical distancing that's recommended. When you are doing rescues, if you do have to do a rescue, we invite you to evaluate the situation and see if a rescue that maintains 2 meter distance could be appropriate. So you could be using your ladder approach. So can you execute the rescue with a reaching pole from outside of the water? If you go in the water, we would recommend using a rescue tube or a rescue can that have the 2 meters of rope attached to them. That would allow for 2 meters of separation during a tow. If that's not possible, contact rescues are still an option, but they'll be used as a last resort. For general first aid, just a reminder that your safety is important, just as the safety of your colleagues, your co-workers, the victim, and other witnesses and bystanders around you. So whenever possible, we're going to maintain 2 meters of distance between us and the victim. So that could mean that we're promoting self-care. You could be handing a disinfectant wipe and a Band-Aid to a victim, or perhaps to someone who lives in the same household who can help you. If it is necessary to intervene at a closer distance, so a distance of less than 2 meters, you have to take the appropriate safety measures. So that means having a procedural mask, protective glasses, gloves, and ideally a gown. And the victim would also be encouraged to wear a procedural mask too if they tolerate it. So obviously a victim who's having some kind of respiratory difficulty, an asthma attack, hyperventilation, they won't be asked to wear a procedural mask, and little children often don't tolerate masks well either, as they have a tendency to play with them and touch them, which would be counterindicated. If you are not wearing the procedural gown, which we said is optional, but you're doing an intervention in close proximity, it is recommended that you change your clothes, so you have a spare uniform or a spare change of clothes with you so you can change after an intervention. After the intervention, dispose properly of any PPE. Disposable PPE again goes into the waste. Reusable gets sanitized, and wash your hands before continuing with any more duties. If you are in a position where you have to engage in resuscitation, the Public Health Institute does recognize that people who are in a drowning situation really do need ventilation during CPR. So they recommend for someone who's in a drowning situation that CPR be performed as usual with compressions and breaths with a mask that has an antiviral filter. So the first situation we'll look at is when you have 2 people who are doing CPR. One rescuer is going to be performing compressions, and they need to wear full PPE. So they're going to have on their mask, eye protection, gloves, and ideally a surgical gown. And a second lifeguard will be doing the ventilations. And that person will have on all the same PPE except for the mask. Obviously, they won't be able to give breath while they're wearing a mask themselves. It's important that the lifeguard who's doing the ventilations holds the mask in place during the entire intervention. So while they're giving breath, and as well while the compressions are going on. And that's going to keep a seal around the mouth at all times to protect the lifeguards from possible contamination from the victim. If there's only one lifeguard, then we recommend using a mask that has the elasticated band that would keep the mask firmly in place while you're doing compressions. And this lifeguard, again, because they're performing ventilations, wouldn't be wearing a mask themselves. There's also a possibility that if there's a close family member, someone who lives at the same residence, who's trained and comfortable to assist, then they can assist in the role of giving the ventilations to minimize any risk. In cases where it is not a drowning, so it's someone who's out of the water who needs CPR, the recommendation for an adult is to proceed with hands-only CPR or compression-only CPR and use an AED. If this is the case, the victim's face should be covered with a piece of fabric to avoid possible contamination to the rescuers. For children, just like a drowning victim, they're likely in a respiratory arrest, and ventilations are important for their recovery. So we do still recommend that children get compressions and breaths, as usual, with an antiviral filter, with the rescuers wearing the appropriate PPE as discussed for the drowning victim. We'll just show you now a couple pictures of pocket masks in place. The one on the left is an example of how to secure a mask if you're working alone with the green elastic band that you can see. This way, then the lifeguard goes to do compressions, the mask will remain in place on the victim's face. On the right, you have an example of someone who's doing only ventilations. They're situated behind the victim to leave place for the compressor, and they'll be holding the mask in place at all times, including during compressions. In both these cases, you'll see that the mask has an oxygen inlet. If your facility doesn't use oxygen and you're using a mask that has the oxygen inlet, it needs to be covered and closed while you're doing resuscitation, again, if you don't have any oxygen hooked up to it. And we'll go to the next slide. The next few slides are examples of posters that could be placed in a first aid room or by first aid kits. This one is a reminder of how to wash your hands, so it could be important for after an intervention, once you've removed your PPE, to just remind you how to wash your hands. If it's taking you less than 20 seconds, you're probably not doing it right. The next one is reminders on how to take off your gloves without contaminating your hands. Even if you follow the procedure, it is still recommended to wash your hands after. When you're removing gloves, your first glove is pinched from the outside and pulled down slowly so it doesn't create any splash if there's liquid on it. You hold that glove in your second hand, remove your second glove by putting your fingers inside the cuff and again inverting it slowly over your hand. Don't forget to wash your hands. The mask, people are going to be wearing masks. It's important to have a reminder somewhere. They have to wash their hands before putting on their mask. They should wash their hands before taking it off and wash their hands after it's been removed. So the whole mask on, mask off process involves 3 times of washing your hands. When it's in place, it's important not to touch it. If people are having trouble hearing you, talk louder, don't remove it, don't pull it down to be able to talk to someone, especially if they're within the 2-meter bubble, and it needs to be changed as soon as the mask is dirty, as soon as it gets wet, if it's uncomfortable, and then it would need to be changed if you're still in a situation where you're going to be close to someone. And again, this is another example of a poster. This includes visors, there's the surgical gown, how to take things on and off properly. If this PPE is available to you and you're not comfortable in how to put it on and off, then you can seek further training. There's some good videos available as well for use of PPE through the Life Saving Society and on YouTube in general. Other resources for you to help you stay informed throughout your return to work. The survival chain, the first document here is the link to the Public Health Authority, Urgence Santé's resuscitation protocol that we're following for our regular resuscitation and for resuscitation during a drowning situation. So if you want to see those recommendations right from the source, you can see them there. The Régie du Bâtiment du Québec is a link to their certification extension that's going to be expiring mid-July. Public Health as well has updates on first aid prevention measures in the workplace. We also have links, and the presentation will be made available to you, so you'll be able to get the links there. You don't have to scribble them down right now. These are more updates from Quebec Public Health, proper protocols to clean surfaces, and questions and answers about swimming pool areas. And the last one is a link to APSAM. Their APSAM is the Health and Safety Organization for the Montreal area, and that's a link to their guide for special specifications regarding recreational facilities, swimming pools. And I believe I am passing it back on to Eric now.
Thank you, Simon. Just a quick word about, before I go on those last slides, about maximum bather ratio. We didn't talk about that in the previous slides. It's really important that you go and look what your federation are recommending to do. There has been a lot of updates in the last week. We went to some standards, others change again yesterday and today. We receive updates from those federations, so it's important that you follow them. They are allowing more and more swimmers per lane, so this will help you restart your activities. Also, some of the federation will ask you to sign an acknowledgement risk for your participant and athletes, and others are asking you to keep tracks of which participant came on which day and was in contact with whom. So if there's an outbreak, then there is a way to alert the other participant of the risk that they were exposed to. So those are really varies from one federation to another. So go look for the information on their website. They are all doing updates frequently, and they're following this topic pretty closely. So what to remember? Remember to wash your hands frequently. Do not touch your face like I just did. Keep a 2-meter distance. Remember, when we are a coach, we tend to speak louder on the deck. So if we speak louder, then there are more droplets that are expelled, or they are expelled further. So keep your distance. Regularly disinfect surfaces and objects. Make sure that you have all the PPEs available for you, and keep yourself informed of all the info. Things are moving really fast. Next slide, please. Thank you. So a quick disclaimer. Remember, as the health officers often said, what was good yesterday is probably not going to be good today, and again for tomorrow things are probably going to be changing. We are trying to share all the updated information that we have. If we have any updates, we will always be sharing that information on our website. So follow us and follow the resources that Simon has been presenting a few slides before. It's important to have to be informed of any change. So I think we went over the presentation.
Eric, we have a question on the Q&A. There's very quiet and shy on the Q&A. So the second question on the Q&A is there an increased risk in salt water pool when it comes to providing backyard lesson? So what's happened with the water saltwater pools?
It's a really good question about saltwater pools. It's interesting to know that saltwater pools are chlorinated pools. So salt water is really just the way that we are adding the chlorinate into the pool, the chlorine into the pool. So if we are doing a test in your pool that is using salt water, we should have the same result in chlorine levels than we will have if we are chlorine our pool with liquid chlorine or solid chlorine. So basically the salt is placed into the water, and we send a small electric charge into the water, about 5 millivolt, and it allows to split the salt molecules. So in French you have sodium each glass, so the chlorine is being liberated into the water, and you do have chlorine in your water even using a salt system. So in the end, it's the same, no issues there.
Okay, thank you. So thank you, Eric. Thank you, Simon. Thank you, Renald and Joanne. You're invited to consult all the documentation on the website that will be available during the weekend. Make sure to stay up to date about the information because that's changed often and quickly. Also, for the organization of sport activity in the context of COVID-19, contact your sport federation or check your sport recovery plan. If you have any question, don't hesitate to contact us or contact your federation. So thank you for your presence today and have a good weekend.